One of the questions I think that will be on the minds of lots of people on this campus is, what's the impact of health reform on college students? One of the important features of this legislation is to change the law that covers adult children and allows them to be covered for a longer period of time on their parents' insurance policy. The law now, this year, is changed, and it'll be until a person has 26th birthday.
As President Obama stated, if you have health insurance, if you like your coverage, you can keep it. People that like their health insurance coverage won't experience any changes. If you're a student, you go to student health, that's not going to change. The package of reforms that was passed is not going to affect student health, whether you like student health, whether you don't like student health. I don't think the bill's going to do a whole lot for you.
Well, I don't have any direct evidence, but I hear students saying that sometimes there's a long wait and sometimes it's difficult to get a referral to a specialist and difficult to get their acute problems handled in a timely way. And so what I meant to say was, if the healthcare reform goes through, even in a small way, this would give people like that access to other sites, not just in student health, which would, I think, ease the congestion. I think student health, probably the biggest problem is the congestion and the oversubscription. As I understand it, it's going to be able to allow students to have coverage for primary care services, which up until now have not been easy to access. And primary care, not just because I'm a primary care physician, but I would say generally people need to have a relationship with a primary care physician and have access to a primary care physician.
What will happen over time is, because of the covering of the uninsured, more and more people who come to us will have the ability to pay for their care, and so this huge burden of indigent patients unable to pay for care will be lessened.
Of course, remember that this is still several years away. Even if it's signed now, we're still looking at 2, 3, 4, 5 more years.